Welcome, everybody. Welcome, everyone. I see people are joining us. I appreciate you joining us tonight. Thank you. And they're rolling in.
Awesome. Right on time.
Yes. Welcome, everyone. Thank you for joining us tonight. We'll wait a few more minutes to give folks time to join us. So excited to have you this evening joining us. Welcome, everyone. Okay, let's go ahead and get started. My name is Zaida Banassi. I am a member of the class of 1985, and I serve as Director for Alumni Engagement for regional and campus programs. Thank you for joining us this evening. A few housekeeping items before we get started. Please feel free to submit questions. You can do this by using the Q&A button at the bottom of your screen. We will do our best to answer all questions throughout the webcast tonight. The chat has been disabled, but feel free to submit questions throughout the presentation. We are recording the webcast tonight and for future viewing. We will post this on our website in about a week or so. We will send out a link that will direct you towards that in about a week or so. I would like to introduce our panelists. We have Michele Villinski and Bill Christian. Michele is the QG Noblit Professor of Economics and Management, chosen as the Carnegie Case Indiana Professor of the Year in 2012. She has been Chair of Economics and Management, co-director of the Environmental Fellows Program, excuse me, and director of the Management Fellows Program and Robert C. McDermott Center for Management and Entrepreneurship. Michele loves DePauw liberal arts environment and supporting students in their personal and intellectual journeys. Thank you, Michele, for joining us tonight.
Thanks for having me, Zaida.
And Bill Christian, class of 2015, serves as project manager and HIM software testing owner for implementation services at Epic. Bill is the lead of ongoing success for his team, and he focuses on maintaining customer relationships and ensuring long-term success for the Epic HIM application. Bill has worked with clients in almost every state and has had the opportunity to work with organizations in Canada, Switzerland, the United Kingdom, and beyond. Bill has been with Epic since June 2015. Welcome, Bill.
Hey, thanks, Zaida.
Thank you for joining us tonight.
Well, I'm really excited that everybody's joined us, that everybody's here, and I'm gonna sit in and also chime in with questions as Bill and I catch up a little bit. It's always a delight to see a former student and find out what's been going on with them. So why don't we just start there, Bill? Tell us a bit about your background, what you're doing now, and what have you been up to since graduation?
Yeah, so I'm Bill Christian. I was a 2015 grad, as Zaida alluded to. And for the past 5 years, I've been working at a company called Epic in Madison, Wisconsin. I'm a project manager there. And Epic is kind of a unique company. And we'll talk a little bit more about what we do in the healthcare space, but essentially my role is working with any new customer or pre-existing customer that is going and wants a new software solution. So Epic is a product that works for if you need registration data, clinical data, billing data, anything that encapsulates a hospital or clinic experience will go in our system. So it's one system, one patient, one record, and we cover about 72% of the country, and that's not including what we do internationally. So it's a large, broad system, a large, broad scope And I have the opportunity to work with physicians, nurses, people in the privacy and compliance office, billing office staff, executive, just a lot of really different, interesting people, and helping them install a solution that is good for their healthcare systems, good for their patients. And yeah, it's just a really interesting company. So again, we'll talk a lot about it, but that's a little bit about me. Again, I'm based out of Madison, Wisconsin. During the COVID time, I bought a house, I got engaged. There have been a lot of really fun things that have happened in the last few months, but try to be involved in the community. And yeah, I'm just really excited to try to teach people about the electronic medical record space, which isn't necessarily the one thing people talk a lot about in healthcare. So.
Great. Well, I'm glad that you had time to spend an hour with us tonight so we can learn about your perspective and what's going on from your view in the world of healthcare. So for everybody who has joined us, we, at DePauw, we really like active learning and things like that. So we have a few poll questions that we'll send out from time to time. Feel free to weigh in. We're just curious about a few things, and that may weave into our conversation. And I think we'll have our first poll question, just we want to get going right away. Our first poll question coming up just about now. So keep your eyes open for that. So Bill, as you know, probably even better than I do, the healthcare industry is enormous, it's complex, it has a myriad of players and stakeholders. How do you and Epic fit into this dynamic landscape?
Yeah, a good question. So as I alluded to, right, we are the system that stores all the data, right? Nurses, doctors, billers, registrars all enter data in our system related to the patient's stay. We install in all states, significant amount of countries. So all of that data needs to live somewhere and go somewhere. So if you are in Colorado and you are skiing, but you are living in Indiana currently, and you take a tumble, which I have done a few times, and you break your collarbone, you might be admitted to a hospital. And from there, it might be helpful to know that you have certain allergies, you have a certain, you have certain medical history or surgical history. With Epic, you have the capability of having all that data stored, whether it's in your home hospital in Indiana, but it can be sent there to your hospital that you're currently at in Colorado. So the ability to interoperate and send data from different platforms, whether it's Cerner or Athena or Allscripts, those are competitors, over to Epic, or from an Epic to an Epic facility, having that data in your electronic medical record can make that experience critical if you have severe allergies, or if you have medical history that's important to know, or just helpful to know along the way. So I think we fit into the healthcare space where, right, if you are in a place that you are not based and your medical record isn't there, you're able to get the information, and the providers taking care of you are able to get the information that you need. In addition to that, there's an element where you have millions of patients' records in a big repository of data. Well, there's a lot you can do with that. So we have products like our Health You Planet product, which helps providers, community organizations know, like, what's going on in my community? What are some of the diseases? What are some of the health problems in certain communities there? So we can take data and claims data and say, we are seeing these type of patients these days, and we can take those reporting metrics and we can take what we learn from that and apply them, and whether it's from a government perspective or whether it's from the healthcare organization, they can take that information and assist their communities so they can lessen patients, whether it's based on readmission, whether it's trying to stem a specific problem, COVID, which I know we'll talk about a little later. Using that data that's stored in Epic, outside of just having it for the patient, but having it for the aggregate, is also super helpful to know in terms of community health.
And you mentioned when you were sort of doing the intro part that you've had an opportunity to work with lots of different stakeholders within the healthcare industry. So that's something, it seems like Epic has given you a chance to do that.
Yeah, super, super cool. Like, I'll be in meetings with, a CMIO, or a physician, a group of nurses, working and trying to figure out, for one project, I had to figure out Canadian rules and regulations for both privacy and regulatory submissions that impacted funding. I think as a project manager here and working for a company like Epic, it's been a dynamic space where I've been able to learn a lot of different really interesting things and leverage some of those skills at DePauw, like, taking a class that you might not necessarily be familiar with, and then obviously, learning and going through that and using a different part of your brain. Well, kind of taking some of those similar skills there from an Epic perspective and saying, how can I take this complex problem that I don't necessarily know a lot about and use these different problem solving skills that I came up with to figure out the best optimal solution that ultimately would impact patient care. So those are some of the things that it requires with working with a lot of people who might not necessarily be easy to, are not the easiest decision makers. I'm trying to find the most political way to say that. But.
I hear you. Cool. Well, you mentioned just recently about COVID, and we all know work, home, social life, they look pretty different for many of us since COVID-19 hit. I'm curious to know what your perspective is on the pandemic, informed by your work experience. We also have a question from one of our participants who's asking, what role is Epic playing in providing better data for COVID-19 disease management? So,
yeah, so I'll break it up into three
questions.
Yeah, so I'll break it up into three parts. First, I'll kind of talk from a personal experience, and then I'll talk about, okay, how it's impacted the healthcare industry. And then third is going like, okay, so what? So what is Epic doing here? So I guess from a personal thing, I am used to traveling pretty much every single week of the year and going out and working with different hospitals. So for a while, I was going in between Philadelphia and Seattle and just doing that every week. So it's been a little nice to be at home, admittedly, and spending some time with my fiance and my dog. So I think that's been an interesting part to my work-life balance specifically. But as you can imagine, the healthcare industry hasn't necessarily slowed down in a lot of ways, and a lot of the priorities have changed. So while my projects might be on hold or might have diverted focus and might have less resources, the opportunities to impact and help out our customers who are on the front lines fighting against COVID is definitely there. So an example of what I've done specifically at Epic is I've been on both our epidemic preparedness team and our COVID response team. So obviously one of the things we've had in New York and other major US cities is we've had the convention centers, the hotels, the USS, I forgot the big battleship, but they've been serving as patient places where patients can go, maybe lower acuity ICU patients. So in part, we want to make sure that each of those patients has access to an electronic medical record and data can get entered in for those patients. So I've had the ability to work specifically on the privacy, a bit on the revenue cycle side, and even some of the scanning front to work with those facilities to make sure, are we getting data in for patients? Are those patients being protected from a privacy perspective? Because, for example, the New York State government is leveraging the system of one of the organizations working there, and there are some privacy considerations there. There's also some privacy considerations with when you document on paper, and how does that paper get in? How do you make sure that you are not just having that paper sit out, and is it getting scanned and shredded? So there are a lot of different considerations there that I've had the capability to work on. I guess more on the aggregate healthcare front, just from my perspective, I work a lot on the privacy and revenue cycle side. I think we've had less privacy concerns overall, and it's more a lot in the revenue cycle side. So one of the things that we were all hearing at the beginning is well, I have a job in healthcare, at least healthcare will be okay. And one of the really interesting things about COVID is that with the pausing of those elective surgeries and a lot of those cases and diverting ICUs to focus on COVID specific patients, that had a really tough revenue impact on a lot of organizations. One of the things I work with is case mix index, which is the calculation of how sick a hospital is. So a lot of it's the combination of inpatients saying if you had a hip replacement and you are an inpatient for X amount of days, you would get X weight. Or if you had sepsis, or if you had another disease that might be more severe and had a longer length of stay, you are deemed sicker. So when you're diverting a lot of those cases, your case mix index, which impacts the reimbursement you would get from like Medicare or other different payers, is really off. So I've just kind of had the capability to kind of see how the revenue has been impacted on the back end. And there have been, furloughs and different things happening in the healthcare industry. So it's just been really interesting from that piece. And then I guess, what is Epic doing as well? So I think Epic's doing a lot. So one of the things we've done for our customers is, from a system perspective, our developers were pretty much in the turbo room for like a month, 2 months, essentially saying to our customers, okay, what system functionality do you need? What are some different things that Epic can develop to say, whether it's one of our best practice indicators that combines some common symptoms for COVID, and say, like, flash an indicator, say we recommend giving a test to this particular patient there. Whether it's on the revenue cycle side and saying, for when you're doing hospital coding, which is making sure you have the appropriate diagnoses associated with a patient's stay, it goes out on a claim, it goes to a payer, it's reviewed, and that's part of the reimbursement. Making sure you have the appropriate COVID specific diagnoses there.
Mm-hmm.
We have an entire packet essentially saying, okay, this is how we can do this in a really easy setup for our customers. We're also doing different things like discounted refuels, which is essentially helping our system, helping our customer system, just cleaning it up a little and making sure that it's up to recommendations. They're using a lot of automation and different tools there. We want to make sure these organizations are efficient. From a reporting perspective, we've done a lot of development, whether it's with our slicer dicer functionality, which is being able to carve out mass amounts of data and really focus in on discrete pieces of data that impact. So whether it's looking at different conditions for a patient and trying to break out and say, what are some of the most common conditions of the patients coming in? Or whether it's some of the mandated regulatory reporting, which we've worked with all of the government agencies, ranging from state and local agencies all the way up to federal agencies, to make sure we're providing the data they need in order for the CDC to help make their best recommendations possible. So it was a long answer, but the answer, I guess, has been we're doing a lot. And it's been an interesting time to be working in healthcare, but it's been really neat to see some of the things we've been doing behind the scenes.
Great. Well, let's have another poll question. Keep everybody engaged and actively giving us information. I have a question that goes in a little bit of a different direction, but I think also builds on some of the things you were just talking about with COVID, especially with regard to patient privacy and things like that. So my father-in-law, he practiced medicine for more than 60 years. And as you can imagine, he has seen a lot of changes in medicine, medical technology, all sorts of things during his career. He was very skeptical of electronic medical records from the very, very beginning. And I've also heard friends and colleagues who have expressed privacy concerns about that. They don't want to activate their MyChart because they're worried that, somebody, Big Brother might be watching, something like that. So from your perspective, what are some of the advantages and disadvantages for patients of electronic medical records?
Yeah, and that's a good question. So I'll start off with the physician usability and user usability piece and kind of delve into the privacy piece too. So for the physician usability piece, I think that's definitely one thing that if an electronic medical record, and this is my opinion, right, were a perfect piece of software, we wouldn't necessarily need software developers, right? It's something that we have to constantly work on making sure that we are bettering our software and making it more useful for our clinicians. So one of the metrics we track pretty seriously is our physician burnout and the amount of clicks that our physicians have to do.
Okay.
We don't want our physicians constantly, when they are seeing a patient, we don't want them doing what we're doing, looking at a screen. We don't want them clicking and going every single different place. We want them to interact with the patient. So a few things that we do at Epic is, first of all, when we train our physicians, we do it in a model called specialist training specialist, which is we want not like an Epic trainer like me or one of my colleagues coming out there. We want their own colleagues training. So we want to make sure that we improve our training effort, because a cardiologist is more likely to listen to a cardiologist as a cardiologist is more likely to listen to Bill Christian. The second thing is we do things such as clinical content design. We do physician personalization. So if you're a nephrologist, we want to make sure that you have like the top 20 things that you need. Because right, it's important that we get the patient data in the system. It's important that you document, especially in the cases of those patients that a nephrologist would see, those particular, it's important for that documentation to get in the system, but we don't want a lot of clicks. So if we get the top 20 things or some common care pathways that we have, and we reduce the amount of clicks significantly, we find that our physicians are much happier than with the system, that it's personalized, it's customized, it's tailored to their specific needs, than if we just give them a product and say, hey, here it is, go with it. That's really something that at Epic we push. But again, you know, physician personalization, you're still clicking in the system. One thing we're also rolling out is My Epic functionality, which is focused on front-end voice recognition. So essentially a physician will speak to Epic as opposed to going in and typing as much in the system. It's something that we haven't picked a certain date for development, but it's something that our developers are actively working on that we revealed last spring. So it's a really cool thing. I know our developers are really focused on it, but our hope is essentially saying, how can we reduce the amount that people are typing and clicking in the system? And how can they see the system as something that can drive reporting and drive different things that they can do? But again, you know, physician burnout is definitely something, especially for those providers that might not be as technologically savvy, something that is important in the industry. In terms of privacy, I work a lot with our compliance department. So I work a lot with sensitive patients. So whether it's patients seen in a behavioral health unit, whether it's patients that are, you know, undergoing a subpoena for some reason, whether it's on the hospital side or the patient side, and they need to protect certain encounters or their entire record, whether it's patients that might be sexually assaulted and go in the ED, right? These are the most sensitive of the sensitive patients.
Right, sure.
Thing that we want to do in Epic is we want to work with our compliance staff to ensure, you know, documentation isn't released inappropriately, documentation isn't shared across the organization, that you only have specialized security to go in the organization. From a broader perspective, I know Epic has done a lot in terms of advocacy with, you know, government regulations. I know we had a big, we were working with the ONC. We had some concerns about some of their information blocking regulations that came, which, you know, our concerns stem more from the Cambridge Analytica side. Like, we don't want our healthcare data to be sold inappropriately. So we had some concerns with ONC's data blocking regulations that came out, and we had to work with them and say, you know, we want to ensure that patient information is regulated. So I think from a broader perspective on what we're doing at Epic is ensuring that, yes, it's important to share information, you know, when in that scenario that I brought up earlier, when you're at a separate healthcare facility that isn't your own, but at the same time, you want to share data in a way that's compliant, and you want to ensure that you are protecting sensitive information.
We have a question from one of our participants who's actually several questions related to this topic. So here's the first one that I'm going to ask you. For the audience, could you explain portability and talk about how the industry is partnering to resolve issues that result from there being hundreds of EMRs, not just the big ones you mentioned? With an emergency room visit, for example, how can a doctor in a rural community access my health record, which might be based in a network in New York City, and one or the other is not Epic?
Yeah, so that's a really good question. So high level answer is we have different programs. So with Epic to Epic organizations, and right, Epic isn't the only EMR that was alluded to. We have our Care Everywhere Health Information Exchange, which you're able to exchange from X Epic facility to Y Epic facility. We also have Care Anywhere, which we can work with non-Epic EMRs in order to exchange certain pieces of data. I don't necessarily know all specifics to that, and I know a lot of it's on our website, but a lot of it's about enrolling within there and following our rules of the road, which relate a lot to data sharing as well. We also have a program called UGM, which is for all of our customers to go and make sure they get the most up-to-date Epic knowledge. We also have UGM, which is for all of our non-organizations to go to see how we can work with Epic to get some of the data that we need in order to work as well. So we are working a lot on that interoperability, especially with those organizations that aren't Epic.
Great. Jay is asking, I believe that I read that Google had purchased patients' healthcare data from Kaiser Permanente, and the patients were not told of that transaction. If I have that correct, then what assurance does any patient have that their data will not be sold without their knowledge?
Yeah, that's a good question, Jay. I think specifically, I don't know if I'm necessarily the right person at Epic to speak to that. I know we have a great legal team that can also help out with that question as well. Unfortunately, as a project manager, I don't want to necessarily answer that question.
Okay. Another concern related to privacy, Kevin is asking, especially in the context of COVID, there's a crucial need for speed and information balancing against privacy concerns. So could you speak more to the ethical review process? Are there folks dedicated to that process at Epic or within the EMR industry as a whole?
I guess for the ethical review, I mean, our general approach is we want to ensure a patient has the data and a provider has the data that they need in order to get the patient well, in order for a provider to do their job appropriately. In terms of that, part of what we also balance at Epic is we want to make sure that we are going to integrate and provide data for a particular organization that's requesting it. They follow our rules for the road in terms of data sharing. We do have not just a team, but several human beings that are dedicated specifically to that. And across the company as well, right? We have a whole Care Everywhere team that focuses on that. We also have a lot of other folks that help with data exchange.
So we have a couple of questions that are looking sort of at the healthcare provider side, maybe. For example, Blair is asking, how do you balance the real-time needs of physicians on the front line with the IT development testing and go live timeline?
Yeah, that's a good question. And Blair, it's a pretty delicate process for the most part. So a lot I do on the project management side is help install plan. So what we would do is, whether we're just installing one ancillary product like our Cupid product, which is for cardiology, or the entire enterprise of a suite, which is the entire Epic system, reg, clinical, billing, or whether we're doing an upgrade, which is just new Epic functionality that will be rolled out at a specific time. Our general installs, they range in time depending on complexity, but if we're doing an entire install, the typical time's around a year, and a lot of it's with system configuration. So one of the things we try to do is we show and say, this is our system, these are the new features here, but we also want to hear from our organizations as well. So we have a pretty methodical install process that says, what are your concerns? What are your questions? Going through that clinical content design process. It's a delicate balance, especially with providers in terms of the amount of time, resources that are needed. And that being said, we work with the organizations beforehand to upfront say we need X amount of time from X amount of people. And then we worked on testing. So we usually have a whole IT team working on testing, ranging from iterative testing to scenario-based testing to revenue cycle specific testing. And then we'll work with a comprehensive training program where, again, we'll have our training specialists for the providers. We'll have general in-classroom training for the organization, making sure everyone's prepared. It takes a village, both on the Epic side and the customer side. So we work together to make sure that even for a small install, even for an upgrade, there is a level of coordination between the two organizations there.
So I think we're getting sort of deeper into how this interface works with the various actors. And Scott has a question about that too. He's wondering how your software helps facilitate exchange of medical information like clinical or diagnostic data, between the medical service providers, insurers, pharmacy benefit managers, et cetera, to speed up the process of obtaining information to get treatments, medications, and stuff. He's worried this might be just adding a level of bureaucracy and inefficiency to the healthcare system.
Yeah, yeah, no, that makes sense. And one thing that's interesting about that, Scott, is we are starting to get into the payer platform space. So we realize, like, when you have Epic, right, you have one system, one record, and it covers a lot of the space in one healthcare facility, but you also have payers, you also have a lot of other organizations and different ancillary systems. So we are starting to broaden where we're installing. We're focusing a lot in the payer space because we realize if we work with the payer space, we can improve other spaces in Epic, like working with healthcare organizations, making sure we have tighter turnaround times, better communication. So it's a challenge, but at the same time, I think we're broadening what we're looking for just from our traditional healthcare organizations and broadening to different types of organizations that are with the healthcare agency or within the healthcare space, but might not necessarily be typical sources where they provide care.
All right, well, let's move on to another question, taking it a little bit of a different direction, but something that I think is really critical to sort of everyday life now. So as many of you know, and I know as you know, Bill, issues related to inclusion and diversity have been getting increased attention at DePauw in recent years, and questions of justice and discrimination have become even more prominent nationwide this summer. So how do these vital issues factor into the healthcare industry? What have you learned about that yourself in your role at Epic?
Yeah, so that's a great question. I think obviously, this is a difficult time, but it's an important time. So, I'll talk about, what I'm trying to learn and how I can try to be a better ally, then also hopefully talk about, how I'm trying to use my role at Epic. So I think the first thing is one of the things I've had interest in before, and I think especially with all of this has grown into more of a passion is, healthcare disparity in general, but specifically in between Black and white communities. It is pretty phenomenally big. So one of the things I'm trying to do some education on via literature, reading the news and trying to get more engaged in what we're doing from an Epic perspective is learning how, what are the biggest points where, where are the biggest concerns, and learning how I can do something about it. So I think from an Epic perspective as well, and what some of our companies working in, a lot of our management has been engaging employees and saying, like, how can we take our software and say, whether it's something like on the HIM side, which is a lot with privacy, which is with identification of patients, and how can we make it in a way that's friendlier, that embraces diversity, and that can be a challenge sometimes for really stretching your mind. For with privacy, some of the conversations we've had have been about treatment of prisoners and saying, like, how can we make sure their information is protected in the system, ranging from identification, whether it's Black patients, and making sure that we're asking the appropriate questions at registration, or transgender patients, right? We have a whole team dedicated to transgender patients as well, and making sure that we approach that appropriately. I guess in terms of what we're doing at Epic as well, we are trying to use this as a platform in order to make general change in the community. So an example of that is we are partnering with, I think it's the Dane County Women's Foundation. Dane County is where Madison is. And we are working to use our care coordination platform to directly address the disparity of Black infant mortality that is very present in Dane County. So we're partnering with an organization, we're providing our data, and we're trying to use our software, right? It's just a software. It's what people type into, it's what people use. At the same time, we have that data that I think is really, really important to provide an outreach for general better care, right? We have a problem, I don't necessarily know all the solutions, but I'm glad I work for a company that is working on bridging the gaps and improving the outcomes.
Okay, well, as a longtime DePauw professor, and a liberal arts graduate myself, I'm always eager to hear alumni reflect on how their undergraduate experiences shape and contribute to their professional and personal successes. And we've had some, so I'm curious, I'm going to ask you to kind of indulge me and talk about that, but we've also had some questions from our participants, from Blair and from Kevin, asking things like, what's your favorite DePauw memory? What did you do when you were at DePauw? How did things like management fellows contribute to what you're doing now? Those kinds of things. So if you want to take a couple of minutes to talk about that, I'd love to hear.
Yeah, for sure. I mean, I think I alluded to it before, and DePauw was a really, it was a really good experience. I alluded to the ability to be able to learn when not necessarily having the background. So when you start at Epic, you are taught how to use a system and you were taught how to be an expert in the system, right? Well, I was an econ major at Epic. I was a minor in Spanish and literature. I didn't necessarily have a ton of information on the healthcare industry when I started. So it was a big learning curve. And while I took Computer Science 101, I didn't necessarily have a lot of IT background. I didn't necessarily have a lot of systems background. So using some of those skills I learned at DePauw to focus on, training my brain to focus on things I might not necessarily be super familiar with and focusing on learning. There was that curve at Epic where I said, I need to be an expert in a system. I need to be an expert at Epic. I need to be able to speak to complex healthcare issues, whether it's based on privacy, patient care, general reporting, speaking what's going on in the health information management industry as well, how I can speak to those particular issues eloquently and provide direction to people that might have been in the industry for X amount of years. And that was definitely a really steep learning curve. It was hard. It's still hard. I'm still learning every day. I'm still trying to have that continuous learning, whether it's, trying to learn how to be a better ally, or like specifically in my job right now, I want to learn how to be, more integrated in the Epic revenue cycle. Like, how can we get claims out the door faster? How can we increase things like price transparency? How can we help these organizations that are, some of them are struggling right now. So I'm trying to learn different things. I think at DePauw, I had a lot of leadership experiences. So with Epic, I've had the capability to work, again, with a lot of different people. But internally, right, we have teams of about 30 to 40 people on our installs. And they all have, different backgrounds, different experiences, and we're all working towards the same goal, getting these hospitals live on Epic in a way that doesn't impact the normal course of work for these organizations, and making life easier on nurses, doctors, and different folks. So taking the leadership opportunities within the teams to take on hard issues and help move projects forward in a way that is, helpful to the organization. I think specific to favorite memories at DePauw, I think that's hard. I really enjoyed my classes. I really enjoyed the time that I had, I've talked to my fiance about this a few times. Like, I just really enjoyed just sitting in class and learning, just walking around campus and spending a lot of time outside. I really enjoyed my econ and literature classes. I enjoyed sitting out in a hammock and reading. I enjoyed a little more free time in my day and runs through the nature park. And obviously all the friends and relationships that you form when you travel on the road for, every single week for a year, or 30, 40 weeks in a row, or what it feels like. Those friends and relationships you have, especially mean a lot more. And, it was a really, really good experience. And I think I learned a lot. And I think as I grow through my career and as I have these new opportunities at Epic to help out these healthcare organizations and inevitably help out patients, I think a lot of the lessons that I learned at DePauw will ultimately hopefully serve me well.
Well, Bill, I'm so disappointed. I was pretty sure you were going to say your favorite DePauw memory was game theory class with me.
Yeah. Well, you could have given me a slightly better grade, and that might have helped sweeten it. So
I can't even believe you remember your grade in that class, but all right. Well, we have some time for some questions from the participants. I have a couple already here, so I'll just start asking those of you. We have about just under 10 minutes. So everybody who's listening, if you have a burning question, now is the time to type it into the Q&A pane, which you can access at the bottom of your screen. So I invite you to do that. So Stephen is wondering, what types of analytics can be run on Epic using the data available? So for example, are you able to be predictive? How is the data accessed? Do you provide standardized reports, customizable dashboards? He's curious about all of that sort of end of thing.
Well, that's a pretty broad question, but it's a good question, right? With Epic, we have a mix of a lot of different types of reports. We have real-time reporting. So for example, on the revenue cycle side, you might be wondering, where are my dollars? Where is the AR held up? I want to know, where I need to, staff some extra support. So we have those real-time reports. So if you're a manager, especially, you can go and run those. We also have, I alluded to our slicer dicer, but that's where you can essentially say, we have this aggregate of patient data, whether it's clinical, based on the revenue cycle. We have 20 plus models where you can essentially say, I want to slice and dice how I want to. I want to say, I want to look for these patients with these diagnoses seen in these units between these days by these providers, the general outcomes with them. So you have the ability to slice that as well. We're also really focused on predictive analytics as a company. So one of the things that I know is a really important metric that they do is focusing on readmission rates and patients that might be probable for readmissions. So that's just an example of one of the things that we can do, but we have a pretty wide breadth of reporting, ranging from some of the clinical to registration to revenue cycle. And really, again, we're focused on that predictive analytic piece. And I think through the next few years, especially, we're going to have a lot more coming out.
So Patrick has another question kind of related to this. It's about data. So as genetics continues to become a large part of the healthcare industry, what steps has Epic taken to integrate genomics lab data back into hospitals and academic institutions? He says this information can benefit research and patient care. So he's just curious to know what Epic's doing about that, if anything.
Yeah, I'll be honest, Patrick. I don't necessarily know the specifics of that. I do know that we integrate with systems that send some genetics data in terms of like having an application. I don't think that's there. So I can make sure I note that question down and dig that answer up.
Okay. Well, here's a sort of a broader question. So what do you see as emerging challenges for U.S. healthcare, and maybe also for Epic? And one of our participants is wondering, what does the economic future hold for large nonprofit hospital systems like Ascension St. Vincent versus freestanding nonprofit hospitals like Community Indianapolis? That's like a lot, but you can pick what you want out of that.
Yeah. And again, this is my opinion, not necessarily the opinion of the company. So just want to make sure that's clear. I think that's really interesting and a pretty complex question. I guess I don't necessarily know. I don't necessarily know how to answer that question. So
too big, maybe.
Too big, yeah. And there's just so much uncertainty going on right now. I think my question, my answer 3 months ago might be different than my answer 3 months after.
Yeah, I understand
I
that.
think there's a lot of challenge for hospitals like that, especially those nonprofit hospitals like that, in terms of the costliness of healthcare, in terms of, I guess the costliness of healthcare and the level of uncertainty. I don't necessarily know the best answer for that.
Well, I've talked to several DePauw alums who, many of whom have worked at Epic, who have praised the corporate culture there. So what makes Epic different from other companies, and how does leadership foster that unique culture?
Yeah, so I think Epic, so for those that haven't seen, Google Epic's campus, it's a unique place to work. We have a very large college style campus where we have a mix of different buildings ranging from the wizarding world to a storybook campus to just a lot of different theme buildings that we keep on building. So part of it is we have a high percentage of our employees that are developers, that are technical, that work a lot with the design of the system. So one of the things that our CEO preaches is she wants an environment that fosters creativity, is fun, that people want to go to work. So I think we've designed a place where people want to go to work, people want to be there. And I think our CEO, Judy Faulkner, has done a really nice job of that. I think in addition there, we have little different things. So for example, we have 10 commandments. So we have things like software must work. We have things like we want to work with our customers, say yes, and say we can customize, but at the same time, if we have concerns, voice those concerns. We have them posted up in all these different places on campus, ranging from our break rooms to our bathrooms. And there's just, we have those type of small little things about culture, but they're just posted everywhere. We have our own office because it's easier to work in different places, and our CEO believes like it's better if you have your own space to sit down and work in and do different things there. So I think it's a fun culture, but it's also something that like we want to make sure that we are serving our customers. We want to make sure that we are in a place that will help us do our best work and will help us be focused. But we also want to be in a place that we want to work to come in. We're excited to work for customers because ultimately we're trying to impact patient lives. So I think we have very ingrained culture. We have things like monthly staff meetings. So I do think we have a good culture. It's a hard job. It's hard to work with and make sure that we have positive outcomes to patients through our system. But at the same time, I do feel like our culture is set up for success to support a positive workforce approaching those problems.
So are there any parts of that culture you think DePauw should try to adapt to our environment? Do you have any recommendations to make on that front?
There's some things I don't necessarily know would fly at DePauw. I think a castle would be cool. I don't necessarily know if the board would approve that particular expenditure. I do think one of the things that's really neat about Epic is that we have reminders of our culture everywhere, whether it, put it in bathrooms or break rooms. We have our monthly staff meetings. I think reminders of culture and reminders of like what we're there for and reminders of what our mission is as an employee is definitely important and helps there. I don't necessarily know if DePauw needs that. I think DePauw overall has a pretty positive culture. I think people love DePauw. I still love DePauw. And I think people are focused and excited and have a positive impact when they're in class there. So,
yeah. Well, I don't know if you've had a chance to visit the new dining hall, Hoover,
yes.
But some people call that Hogwarts. So maybe we're like heading in that direction a little bit.
Yeah, it made me very jealous that my brother went there when there was that dining hall. It was so cool going through.
It's pretty fantastic for sure.
Yeah.
All right. So I guess one last question. So during your years at Epic, you've had a chance to work in both the US and in other countries. So what are some of the differences that you've seen in the healthcare industry or in the healthcare situation in other countries that you think that we might be able to learn from or worth noting?
Yeah. So I definitely think some things that are worth noting. I think first, a lot of my experience in Canada and these other countries is that the billing system, as you can imagine, is completely different. So the way patient bills go out, in Epic, a lot of it's fee for service, it's charge based. And when you go through these other countries, for example, like Canada, when I worked there, a lot of it was based off like regulatory submissions. So a conglomerate of different forms of data, and only a small part of it was fee for service. So it was just really interesting from my perspective because I worked in the revenue cycle piece for that project. I kind of juxtapose and say, well, I've worked on a US project before where AR is really, really important. And then with Canada, when I was working for the hospital out there, AR was a metric that, yes, it was important, but one of the more important metrics was, okay, we need to make sure we submit all of these regulatory submissions. We need to make sure they're correct. We need to make sure that the diagnoses are appropriate. And I think that revenue cycle focus, from my perspective, I think that was the thing that really stuck out most. It was a really cool learning experience. I guess in terms of things that I think would be helpful in the recommendations there, like, I don't necessarily know if I have any, but yeah, I do think seeing the two different billing structures together, seeing different complexities in different places, I think that was the most valuable piece of experience that I saw there.
Mhm. So where do you see, or where do you hope that your path at Epic will take you? I mean, you've told us a bit about what you're doing now and what your experiences have been so far, but what sort of things do you aspire to before your time there is finished, whenever that is?
Yeah, I mean, that's a good question. Right now, I'm focusing on working on a revenue cycle path, right? I really like talking to people. I really like interacting with people. I like helping show, like, how can we make jobs easier? So that's in part what I'm focused on.
Mhm.
So I'm approaching more of that role where both in the install and long-term customer engagement, I'm working with different executives from different organizations to help say, like, from a revenue cycle perspective, are you doing things like price transparency in my chart? We're showing that there. Are you doing things that, how can you automate the healthcare system or automate the back end so you're saving time for individuals to focus on some of the more complex cases? In addition, one of the things I'm really trying to work on is finding more interactions that I can have with customers. So we have a program called a BFF program. So it's essentially a person from Epic that partners with an organization for the long term, and they work and say, they work with different leadership from different customers. They're making sure they're staying up to date on the different Epic programs that we have. A lot of what we're trying to do is roll out to improve the clinical registration billing experience as a whole. So we want to make sure they're in tune, in touch with that, but just having a long, a long relationship where you're talking a few hours every week and working together and saying, like, how can we as Epic help out you? So I want to take more of that path where I can effectively engage with those people, because if I can do anything even small to help out and make the system a little better, it's an uphill battle, but if I can do something small to help out with that, yeah, I think that would be important.
All right. Well, thanks so much, Bill. I think we're about out of time. I think Zaida is going to wrap up for us the very final bit, but I really appreciate the time to talk to you, get your take on some big issues, find out what you've been doing, and just really feels great to reconnect. And thank everybody who joined us too. We really appreciate having you and your questions.
Yeah, thanks so much, everyone. I hope you learned something. I hope it was fun, but I appreciate everyone staying on, and hope you have a great rest of your evening. Oh, you're on mute, Zaida.
Sorry about that. I want to thank Michele and Bill for sharing their time and talents with us tonight. I want to thank all the alumni and friends who joined us this evening. Thank you very much for tuning in. As I mentioned earlier, we will send a link with the recording once we put it on our website. It will also include a very, very short survey. Basically, your opinion matters to us. Please let us know what webcasts you have liked and what you want to see in the future. We appreciate your feedback on that. Some upcoming events on Thursday, this Thursday, we have something for our future Tigers. We have a crafternoon focusing on everyday superheroes. Next week, we have a career panel, how a career pivot or not can help you pursue your passions. So for now, I want to say thank you very much for tuning in. Have a great rest of the week, and we hope to see you virtually soon. Have a great evening, everybody. Thank you.
Bye.